Hello guys, this is Dr. Zafar Habib Khan and welcome to our YouTube channel. So today we will discuss about the topic of preeclampsia, which is hypertension in pregnancy. Many people are suffering from hypertension and they are taking antihypertensive medications. But you know which medicines are contraindicated that will kill your child in the womb. So let's discuss about the medicines. The medicines that are taking in the hypertension in the pregnancy are the medicine that will kill your baby in the womb are ACE inhibitors and ARBs. What is ACE inhibitor? ACE inhibitor is the Angiotensin-Converting Enzyme inhibitor. The medicines includes capotine like captopril and lisinopril and enalapril. And what ACE inhibitors do? ACE inhibitors is an angiotensin-converting enzyme inhibitor. So it will convert angiotensin 1 into angiotensin 2. It is the enzyme that will convert angiotensin 1 into angiotensin 2. So ACE inhibitor works in this way that it will block the conversion of angiotensin 1 into angiotensin 2 and will grow and block the channels and will lower the hypertension. So next one is the ARBs. ARBs are the angiotensin receptor blockers, and ARBs includes the medicines valsartan, olmesartan and irbesartans. It will block the channels and the receptors of angiotensin and it will convert the blood pressure into lower or hypotension. So it will minimize the blood pressure and will relieve from hypertension. So if this condition is a preeclampsia in when the pregnant woman suffer from the hypertension. So it will be treated and it can't be given these type of medicines that are contraindicated that will be toxic for the womb or the child. So be careful and take the medicines that are safe in the pregnancy and be safe. Thank you.